So this is the Caregiver Lifestyle series. Today, if you would like to hear this in your own language, we have many of the languages that were registered. At the bottom, you should see a globe, and you should be able to switch into the language of your choice. So you can do that now. And this interpretation is made possible by PTC Therapeutics, Little Brave Ones, and Translate by Humans. And we really do appreciate everyone's support because we're all over the globe, and it's important that we also make it accessible to everybody. And language is a huge part of that, which is what we're talking about today. The flow of today's meeting is we'll do a quick introductions. We'll get right started to our SLP or speech language workshop. And then at the end of the session, we'll have a Q&A session so that parents can ask specific questions, and we can have a little bit more information about how we can follow up with our newsletter or our resources. So today you had Judy open up our discussion. Judy works with us at TeachRare. She's my wife, and she's the mother of our daughter who has AADC deficiency. By daytime, though, she is a special education teacher. I am Richard Pullen. I'm the president of TeachRare, and by daytime, I am a middle school principal. We also have Ivana joining us, and Ivana has been a significant player in helping support TeachRare get started. We just celebrated our 1-year anniversary, and it's been a big learning process. Many of the things that we're doing, we've been doing in education, and now we're concentrating our efforts, volunteering our time to make it content available for parents in the rare disease community. So Ivana has been a big player in helping us get started. So I appreciate Ivana being here today. And then last but not least, we have our guest host, who is Ming Feng. He's a speech therapist. And I'm going to just have Judy start by introducing Ming by talking about our own daughter's journey.
So when we first started speech therapy, we went through many different clinics, and many of the clinics that we visited, they didn't want to take us because our daughter was really young at the time. And as a special education teacher, I knew that speech therapy is important and early intervention is important. But everywhere we went, they would be like, oh, come back when she's at this age, or come back when she's older, come back when she's sitting. So then I started Googling, and I did go to different therapists, and I spent hundreds of dollars at each place, hearing that I can't go to see them, and just I was just sent home every time, and I've spent so much money. So then I started Googling, and I met Ming Feng online, and what attracted me was he said, oh, you don't have to spend so much money, just join my session. I'll give you tips and strategies and share videos with me, and your child's going to improve. So I did do that. I met Ming for a session, and I took videos and I took his tips and strategies, and slowly Riley started to speak, and she started saying mama and dada, and then started asking for things. And that's when I realized the sessions really work online. So that's where I met Ming, and I'm really grateful that I met him, and I'm really happy that he's here today.
Thank you, Ming, for joining us. We'll turn it over to you.
Hi. Well, thank you. Thanks, Judy, for such a flattering introduction. So I want to start today by thanking you guys for asking me to speak here. And wow, it's been 2.5 years since I first talked to you, Judy, and that's great to hear that your daughter's doing great now. So I'll start by talking a little bit about what speech therapy is and so on. And obviously you guys know already. So I'm going to cut to the chase and start talk about why speech therapy is important. Obviously, I'm a speech therapist, so I'll slow down a little bit. Sorry. So I'm kind of like talking about why you should do the thing that I do for a living, right? So the first thing is this, all right? Speech therapy is, or just child therapy in general, this kind of, our industry is always like a kind of a way to mitigate risk, right? There's two ways to look at it. So maybe your child is young and you're afraid that he or she won't be able to communicate with you, and that age might be below 2, and that's why a lot of clinics will say, let's wait until 2, right? Because it's easier to handle, so on, yada yada. But at the same time, the parent's mindset is, I need to reduce this risk, right? Therefore, I need to find someone to mitigate this, right? Just in case my child needs this, I'll give it to my kid, right? And there's number 2, whereas it's already been like 3 years old, right? And the child isn't communicating with you yet, and therefore you're getting a little bit anxious, and therefore you're pushing therapy as much as you can on the child to get them to the next level, right? So the first point I want to make is, in this whole industry, you never know whether your child will speak or not. Okay, actually, no one knows, right? And anyone who says that they know are probably wrong, because as much as I want to tell you, come work with me or any therapist in the world, go work with anyone. Your child's gonna be talking in 6 months or whatever. That's like that. Those are claims that cannot be substantiated, right? It's very difficult for any therapist to say that. And sadly, in a lot of countries, that's what's happening because it's not regulated and so on. So I want to start off with talking about a story about an Indian kid who lives in Indonesia, and he came to me. And I'm not saying this because I'm really good or whatever. I'm just telling you, if you put in consistent work and what your goal is, then it's just a matter of time and fixing and thinking about to get to a better place than where you are right now. I'm not going to say that your kid's going to talk or whatever. That's wrong to say that. So this little kid, I'll call him A, okay? It's an abbreviation. So A, when he came to me, he was 4. He has a rare genetic disease. Decided to pick this story because of this talk we're in. So rare that I've never heard of it. And it's like 1 in a million or something. And just to give you a little context, right? He has an open mouth all the time. He has an open jaw, like open bite, as we call it. And then his head is rather big. And he looks very cute because of that. And so when he came to me, he had like 0 language skills. And they've been going to therapy in Indonesia where they were trying to like just force him to imitate, force him to talk. Force is a strong word. I would say that it's more of a trying to make him do something, and and the kid would always cry, and he would hold on to things. He had retention of certain reflexes, and he would hold on to things, and he wouldn't let go. So I'm gonna just fast forward everything. You know how like in movies, like there's training montages and whatnot, right? So what happened was, we were stuck on teaching him to just follow my mouth opening like this without a sound for like 6 months, right? 6 months of that. And the mom was very trusting, right? For me to keep on doing it. And they kept on working at it at home until one day, suddenly he started to say, out of nowhere, like to imitate, right? Other than that, a lot of times when he would vocalize, it was just random babbles, right? It's the first time in his life that it was intentional. And we'll talk about intention a lot more in this talk, all right? So fast forward till today, like from the beginning at 4, now he's like nearly 8, right? During this time frame, he went from 0 to starting to speak in like full sentences now. And although that there's a lot of sounds that are wrong, and I know that the mother is still fixing those sounds. We've come a long way, and certainly at 4 years old, nonverbal, and that a lot of times the clinics, even when they went to Singapore, they didn't give high hopes or whatever. So I'm telling the story to give you guys some hope. And at the same time, no one knows. All right. When I start, I didn't think whether he was going to speak or not. I'm just taking it one goal at a time, one step at a time. If he didn't speak, can he do some like gestures, right? And we taught him gestures. And because his motor skills weren't good, he liked to turn like lights on and off. And this was light on and off for him. But then he had to put it on his head like this because he couldn't sustain his fine motor, right? He had to put it here. And whenever he did it, his eyes just lit up. And after that, it's just more and more as a bunch of gestures that he learned. And slowly and surely we got to vowels. And then we got to like different sound structures. And finally we got to words, right? So that aside, the story aside, let's talk about what speech therapy is. So speech therapy isn't just about talking. I know this is the selling point of the whole therapy, right? Making kids talk, right? But what it is really is teaching communication. So communication, speech is only one way of communicating, obviously, or else, like all we need is just like people talking. We don't need words. We don't need like, what I mean is like written form, right? And you don't need to see my face as well. There's a lot of information from my gestures, my eye contact, and how I deliver a speech, right? So there is a difference between speech and language, which I know a lot of you know already. So I'm going to breeze through this. Okay. Speech is the sounds I'm making right now that makes sense to you in a language context, right? So if I make a non-speech sound, it might be like wah, 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 but doesn't make sense to you. But speech sounds have a message encoded in it, and you know what it is. That's a speech sound. So language is the message itself. So you can use different ways of expressing it. So it could be, like I said, for the child A, he could use some gestures in the beginning. Or even the most common thing I hear online with parents is that they pull the parent's hand or put their hands on something that they can't open, right? Or put their hands on the TV remote. That's also language, right? Because I have something that I want to communicate with you, but it's just through body contact or body language, so to speak, right? So language is the message itself. It could be words, it could be anything, right? It could be like just me giving you an eye signal, whatever, okay? So therefore, the whole reason for doing speech therapy is to teach a more appropriate way to get your child's needs met. And this is like what it is in the beginning. It's always about, think about what's a more appropriate way. The reason why is because, yeah, I mean, I had another client who is already 11, and she went to a buffet and she didn't know what to do. She wanted like a egg tart or something, and she like put the waiter's hand onto the tray, and the waiter got it, right? So although it's effective to get what for the kid to get what they want and able to communicate, but it's not the most appropriate, because we live in a world where speech is the main medium for communication, right? So if we don't teach the kid to communicate in a more socially acceptable way, there's going to be a lot less opportunities for them to learn, right? Because other people don't find it effective to speak or communicate with that child. That's why we do speech therapy, right? So, and just to get it out of the way, the biggest difference between ABA and speech is that ABA treats everything as a behavior, right? Including speech and language. So they do some of the parts that speech therapy does, but speech therapy talks about communication. All right. So let's talk about the approaches of speech therapy. There are loads of approaches if you search online, right? And like you've heard of some of the things, like you heard of some of the methods if you've been in this speech, this special needs education space for some time. You might heard of talk tools, you might heard of floor time, you might heard of PECs, you might heard of all these things, sunrise method, right? All these different things. So what the approaches are to do the same thing, essentially. Number one, to teach a context and a routine in the beginning. So all things, before you even teach how to communicate, you must have a context. The approach to therapy is always to teach someone a context. So let me give you a real example. So what I see a lot is that parents, trainers, therapists, when they're trying to teach a kid, they're always telling them to like do a certain task, right? Or give me the flashcard, or like say this word, or read this sentence. But why, right? Like, there must be a context. So some easy contexts are like play, right? Some easy contexts are like, for instance, making a coffee for daddy, right? Making a sandwich with mom, right? These contexts have a means to an end, and it needs to make sense on a daily on the daily routine. Okay, so a lot of times kids don't have any context. That's why you see them like throwing things around, right? You see them doing repetitive actions, yeah, and maybe it's that their fine motors are in the way for them to learn any of these contexts. And I say context, the most common thing, context to teach a kid is play, right? So the fundamental approach for any type of child therapy from 0 to 6 years old is always to teach some sort of play routine. Okay, so if I'm not like, I'll talk about this a little bit more later, but what it is about speech therapy, or any type of therapy, to be honest, is to always teach some sort of play so that they can use it to explore things later on their own, right? And the reason why a lot of kids are like stuck to screens is that the screen is so intuitive, like like your phone or whatever. It's very easy for a child to understand. I just need to go to the home screen, tap on YouTube, like scroll down, tap something, and I get to watch it. That's a context. That's the routine. That's easy to understand. Okay, so you might ask, what if my child has no play skills, right? So obviously the first goal should be to teach some play. Okay, no matter, let me give you some examples. So if your child loves like throwing stuff, like to throw things, then maybe what you should do is to teach them to throw, like, I don't know, sandbags, balls into a bucket. That might be fun. Like, I've started off with water bombs a lot of times, and it works, right? So what you do is you make a lot of water bombs, and it's going to take some time. But what you do is you make a bucket with like needles at the bottom, obviously, keep it safe. And the child just needs to throw the water bomb inside of the bucket, and it explodes, and it's fun, right? So always think about how to break down the routines into something that's easy and fun. Okay, so the approach is, number one, teach play. All right, once you can teach play, teach it more so that you have a longer sequence of events so you can teach language later. All right, so what do I mean by that? So for instance, if right now I think someone's microphone is on, so if you could please mute yourself. But anyways, so what is where was I? Well, lost myself a little bit. Okay, so play, right? Well, when I was just talking about throwing a water bomb into a bucket, that's just a one-step play, right? So whenever, and a lot of parents or trainers or whatever, they would love to instantly hold off the child from doing something before, like, and teach them to say a word before allowing them to continue, right? Whilst that's a very effective way to teach a kid, what you got to do instead is to add more steps to it. Okay, so maybe is that how I would add more steps to like the water bomb example, right? Or water balloon, basically. So I would add giving the empty water balloon to me, right? And then teaching him to put his hand on top of the tap, and I put the water balloon onto the tap, turn it on, and then I tie the knot and I give it to him and he throws it, right? So that's one more thing he has to do. And then how you add more is like you put all the water balloons inside of a container and then just shove it to your child. And then he has to ask for help. He has to open it, and then you take it out, and then therefore like you put it on the tap, and then you turn on the tap again, it fills up, tie the knot, you give it to him, he throws it, right? So you're adding more and more steps. Okay. And then maybe later on you can have like two buckets that he can choose in between. Like one is filled with needles. Like how to make this, like, let me tell you so that I don't hurt anyone by giving you this example. So what you do usually is like, those pins you use for putting on cork boards or whatever, right? You make a plastic sheet with a laminator, and then you poke through it, and you make a sheet, and you lay it at the bottom of the bucket, right? That's the way that we use how we use it. Maybe you can have one bucket with all the pins, the sharp stuff inside, and another one with a bunch of marbles, so that the texture and the sensory is a little bit different, and it doesn't explode right away, right? So you can add more things. So you can add choices, you can add more steps, right? So as you create these like play routines for a kid, it needs to be according to the interest. So if they love water, then do something about water. If they love like kinetic stuff like sand and whatever, make some about like using sand, right? If they love Play-Doh and stuff, then use it. Don't try to, we'll talk about sensory later, but don't try to teach your child something that they dislike. That's impossible. Okay. So after you have some play skills, right? So you'll ask me, what if play skills is too hard? So therefore you have to start breaking down the communication into much smaller steps than just play, right? So what does that mean? It means finding rewards, finding things that are like preferable for a child. The last thing you want at home or at a clinic or whatever is that the child refuses to work with you and runs off, right? And doesn't like interacting with you. Okay. So that's not good, because 70% of the time, at least from my experience, the first sessions are always crying, right? It's always about like crying, and we're trying to find something that they like so that we can use as quote unquote baits, but it's actually trying to like that's not a good way of saying it. What I mean is we're trying to gauge the interest of a kid so that there's something that they want from me or you, the parent, so that we can use it to teach an appropriate way for them to communicate with us, right? So why is this so important that we're always talking about preferred activities or rewards, right? Why is this so important? Why is it so, a lot of parents will say, I don't want to always feed my kid M&Ms. I don't want to always use screen time. I don't want to use toys all the time. I just want them to sit down and learn with me using flashcards and whatnot. But you have to remember, every child who is like on the spectrum, have special needs, have rare disorders or diseases and so on, they don't understand why they have to sit down and learn with you, right? And you have to remember, even if your child was quote unquote typical developing, right? A child's attention span would be less than 5 minutes if they were under 3, right? So even if they're above 3, they're still going to be like 15 minutes tops, right? So therefore, you need something to attract them. And I always say, if you're asking a child to sit down with you and work with you without a reward, that's basically the same as you're asking someone to work without a salary. It might be okay for the first like day or two, and afterwards they're like, whatever, they don't want to do it anymore. So what's more important is that once you have these rewards and whatnot, is that you can use the rewards to create longer routines, like I just said, right? Use those rewards to reward the play routines that you teach as a task. Okay, so I might be losing you right now, but I'll get back to it, I promise. And then the last thing is the most important, is to gauge your child's true ability. All right. So you have to remember, all children who cannot speak freely, like effortlessly, talking or communicating in itself is very difficult, right? It's super hard. It's like, for instance, if you know how to write, but then I tell you to write a whole essay with your left hand, if you're right-handed, it's that level of difficulty. So if you're pulling them, there's a Chinese saying, right? If you pull an elephant up a hill or up a tree, whatever, it's super difficult. But if you have like a reward at the top, it's a lot easier. And therefore you will see the true ability of a kid, right? So sometimes I see parents will say, oh, my kid cannot do sound imitation, or they cannot say certain words or certain sounds. But until you have a strong like reward behind it, it's going to be very difficult for us to know whether it's whether they can do it or cannot do it, their ability wise, or they don't want to do it, right? Sometimes it's both, but you have to, both of which can be controlled, right? You can find the reward that they want and make them want it. And number two is that you can decrease the level of difficulty until they can do it, right? So that's a real quick summary of approaches. All right. So I'll do a summary later on, but then I want to keep on going. I want to talk about some example strategies for children who are not communicative, right? So I just talked about rewards, right? The reason why children aren't communicative is that they are confused, right? Why they're confused? Because if they knew how to tell you something to get what they truly want, they would have done it already. That's why they're not talking, because they're confused. They don't understand the link between a spoken word or an action or a sign language or giving you a card or, doing some sort of imitation. The link between that to the outcome, right? And that in its essence is language, right? One word has a link, has a what we call semantic link towards an action or item. So therefore, why children are uncommunicative is because, number one, their needs are already met, right? They don't need to communicate anymore. So that's why you see on the internet a lot of speech therapists, like you type on Google, right? You go, oh, how to teach children, speech delayed children. You will always say, oh, don't withhold the rewards. Don't let them have it until they speak or until they do what you want, right? That's not the best idea, to be honest. That's just only gonna make your child even more frustrated, because I'm dangling a carrot right in front of you, but I'm telling you to do something you don't know how to do it. So basically, again, the two reasons, they cannot do it or they don't want to do it, right? They want to do it already, but they cannot do it, and you're making them frustrated. So therefore, when a child is uncommunicative, it's best that you either lower the difficulty to as low as possible, or is that the reward isn't even rewarding and I don't want it, right? So find out what he or she wants. Right. And now I want you to think about, if they're uncommunicative, think about, how does your child ask for attention, help, and things that they want with you? Because chances are they're already doing it. And you need to look at what form of language they're using already. So that's something also I see in as an oversight, maybe at home a lot of times, is that, yeah, the wants and needs of a child is already met 100%, right? And I'm not telling you to withhold everything. And some tips they say, oh, put everything out of reach, or lock it up, or whatever. There is a time and place for that. There is. But at the same time, are you creating more demand, right? Are you? I always tell parents, are you actively selling a toy? Are you actively selling activity? That's creating creating a more intimate communication between you two, right? Is it always the same routines in the house? Is it always when I bring out the food, the kid comes to sit down, presses play on Coco Melon or whatever, and then they can eat and watch at the same time? Is it always that routine? Are you spending around 5 to 10 minutes to create some sort of demand and let them know, if you communicate with me in a certain way, you get even more stuff, right? It might come in the form of snacks and candies or whatever. It could be, screen time even. Although, you gotta, if you want to push for effective therapy, sometimes you have to use those things that are kind of a necessary evil, so to speak, right? Or it might be some sort of new toy. It might be, I had a student who only liked hand sanitizers and the smell of it, right? And how we expanded the interest was that I asked the parent to buy as many brands as possible, hand sanitizers, right? And then we start to expand from that, and we use soap and so on. And slowly we move towards putting the scent inside of Play-Doh, right? And kinetic sand and whatnot. And then what's that called? The slimes and stuff that we can make together. And then after she was already 10, all right? So after she started to like the scent inside of the slime, we taught her how to make the slime, and then we made a routine out of making a slime, and then we created it step by step, when we taught the words, for instance, scoop, and then pour on the table, right? Add water, and then mix, and so on. And then because she liked videos, she liked to watch those ASMR stuff, we made the whole slime activity into a YouTube video, and we helped her record it and she watched it and she uploaded it and she loved it. Although she was she was still nonverbal at the time. She had the knowledge because she was intelligent about these things. She liked it. So therefore we created these things and we kind of like layered it, right? What's her interest now? How can we make it more interesting for her? Is it the scent? Is it the tactile? Is it the sensory? Okay, cool. It's the scent. So we mix the scent with something else so that becomes something rewarding, and the play routine too, right? And then after that, how can we up level that and make it into a routine? And at this time, we're not even pushing for any language, right? So that's something you can mimic, okay? And we do this for all children. I'm only telling you the stuff that has worked with me, right? I'm not going to regurgitate the stuff you can find on Google or whatnot. So for the story of A, the first kid I was talking about, what we did was that we started off with chips. So just potato chips, the really strong MSG kind. That's the only thing that we could do. At that time, he was on a gluten-free diet, but that was the only thing that we could work with, because other than that, he would just say no to everything. So we had to do that. And slowly we used that potato chip to, how to say, I wouldn't say bribe, right? But I would tell him, after you play this toy with me, and then you can have this chip, right? So he plays with the toy without talking or whatever. He learns how to play it. And then slowly he doesn't even want the potato chip anymore, because playing with me or playing with mom is already very rewarding. So slowly he got rid of that snack. He doesn't even like watching videos. He doesn't like eating that much anymore. And we start to use toys only. And that was the basis for therapy, right? So I'm telling you all of this just to let you know, even before teaching like speech and language, the basis of it is to find something that's rewarding and think about how to expand it in a way that you can do it for a long time, right? The reason why some of the strategies that you see online is because there's not enough context and you haven't seen a therapist do it before. And even if you go in and see the therapist work, it's going to be huge, like very different from you doing at home versus in the clinic. Because at the clinic, there's a structure, there's a table, there's a chair, and all the toys are locked away. And then the therapist has done this so many times. When they're doing it, they don't bother. I mean, I wouldn't bother telling you what's going on, because if I don't concentrate on the kid, they're going to run away, and I lose my authority there, right? So how you can do it at home is to find the things that are rewarding to your kid and expand on it in a way, right? You can either make it embedded like the hand sanitizer girl, or you can use like chips as a means to an end to teach a play or a longer routine. Okay. So what routines are fun? You might ask me, wow, man, it's really difficult for me to think in the way that I think, right? Because I've seen many kids and we've done so many things case by case, right? So what are the surefire ways of making sure that your child likes playing with you? So the answer is what we call social routines. Okay, so what are social routines? Social routines are things that you need no tools with. So it's just your hands. So one of them, the best, is tickling, right? So tickling is great, whatever age. I mean, it wouldn't be appropriate to tickle a kid, I think, over 14, I would think. But, it depends on your cultural appropriateness, right? Whereas in Asia, it's a little bit more conservative. If my client was a girl and then I would tickle her at around 11, that would be already a big no-no. So, but you guys are parents, so it doesn't matter. So it depends on your child's sensory profile, So if your child likes tickling, use it to your advantage, right? Tickle can be you can put it in between things. In between that, you're watching a video. In between that, you're having a meal. And maybe that's not good because you might cough everything out. But it's just short bursts of social routines that can do with the kid to increase that relationship. So how you do it is that you don't force the kid to say something or do a sign or do a gesture or whatever. You just go ahead and tickle. Just give it for free. And then when the kid starts laughing, and then you stop. And then you say tickle and you tickle again. So what you're trying to do here is to make it fun, number one. And number two, say it so many times that whenever you say tickle, he gets tickled. There's a connection between, right? And it's super, and this is what teaching contexts and routines is about, is being very consistent. There's no way that the kid wouldn't understand it over like the course of like 1,000 repetitions of you saying tickle and he gets tickled. It must be that he'll get tickled. He must learn the word, right? So that is true even for nonverbal children. Okay, so tickling is good. Peekaboo is good. So usually how parents do peekaboo is that they peekaboo themselves. And then when they're peekabooing, the kid's gone already. So what you should do instead is to cover the kid's eyes, right? If you cover his eyes for children who are sensory seeking, right? They love it, right? So you cover the eyes and you go peekaboo. And then when you say boo, you open it, right? So the kid starts to like these kind of social routines when they start putting your hand on their body for tickle, putting your hands on their eyes for peekaboo. And it really truly depends on what sensory type your child is and what they like. Maybe they like all of it. I mean, like 90% of the kids love tickling, love peekaboo. And the last one I want to share is like hand swinging, which I learned from my first job. Very, very handy. So you take the two hands of a kid and you just swing them really quickly. And you teach a word like swing and you swing it really, really hard vigorously, and then you just stop. And again, you just say swing and you swing. You keep on doing it until they start to like, when you say swing, they start to move themselves. And then maybe then you can increase your demand and start asking them to say the word or at least utter something. And then if they say anything, do anything, or look at you, you provide a higher level of that social routine. So maybe the swing was like this, but then if they even go, or they look at you, you go, wow, you go crazy, right? And it's the same for tickling and peekaboo. All right. So creating social routines with the child is very, very important, because now you are the toy instead of you need something external. Obviously, having something external is very, very important, as I described, but you need both, So, okay. I'm going to speed up then. So it all starts with intention. Like whenever you talk about speech therapy, it's all about intention. How do we get the child to want to communicate with you? Okay, I hope you understand this part at the very least. Okay, so before I go into like a summary about the stuff I've talked before, let's talk about drooling, which I think Richard told me that might be a good topic to dive into. So because I'm a speech therapist, so drooling is something that I deal with on quite often. So there's usually, I say usually, okay, two reasons why children would drool. Okay, the first reason is that the child cannot manage his or her saliva. There's too much, or the swallowing mechanisms are compromised, right? So that's number one. They cannot handle the amount of saliva. And this might be true. Like for instance, the child I discussed in the very beginning, he also had a drooling problem. Okay, so he actually had too much saliva going on, right? And he couldn't handle it. And he had an open mouth gesture, which doesn't help. So he doesn't have lip seal, whatever. So it just comes down. And then the second reason for it is that the child simply cannot feel it, and that he or her is not aware of the saliva there, right? So it can be both things at the same time, but usually, most importantly, is that it's reason number two. Why do I say it? Because if a child cannot manage saliva, but they're able to drink water and they're able to eat, then there's absolutely no reason why they cannot swallow all the saliva, right? So given that's the fact, right? Because saliva is a little more thick than water. If they can handle the consistency of just plain old water, there's absolutely no reason why a child cannot handle it. It most probably is because they cannot feel it, right? And which is a sensory problem and or awareness problem. So it could be a behavioral problem or it could be a sensory, and it usually is both. So you might say, I mean, what's the point of saying it, right? So anyways, so this might be that the child is hypo or hypersensitive. I'm sure a lot of you guys know what that is. Hypo means there's a lack of sensory awareness, right? The hyper is too much. Okay, so hypo is that they cannot feel the saliva there, or is that is too sensitive that if the saliva hits a certain area of the mouth, they don't want to touch it anymore, and therefore they pull it in front, right? So there are two reasons, and I'm sure you all have been to a dentist before, right? So whenever like you get like painkillers or whatever after like pulling a tooth out, you're not able to speak, you start drooling. That's a sensory problem, right? Because you can't feel it anymore. It's the same thing for children. So so there are two questions usually when you see a speech therapist, I'm sure. I'm not sure if your speech therapist asks you this, right? But the two are usually, does your child not dislike certain textured foods, right? And through this question, we will know whether there's a sensory problem or not, right? Some kids prefer different textured foods, but the main question here is that if those textured foods are not preferred, doesn't mean that it'll actually result to drooling. Usually the answer is like, it depends, right? But the most important question is, does your child not dislike, or even hate brushing teeth? So if your child doesn't like brushing teeth, there's a high chance that your child is hypersensitive, right? Or, which is, again, most of the time, it's a mixed sensory profile for a lot of kids inside the mouth. So some kids will be sensitive up here and not sensitive inside the mouth, right? So it's a mixed thing. And how you do it is to go for assessment, right? So given that, it's best that a speech therapist does this, but usually we use this thing called a toothette. And it's just let me just open it because it's reflecting. So it's part of like the talk tool stuff. And it's just like a sponge. And you can basically just, you can use any old sponge, but it needs to be a little more smooth. So if you can hear it through the mic, it's not that rough. So what you usually do is like, I see that Judy's hand is up. Do you want to ask something or?
Yeah, I'll ask right after this one.
Yeah, cool. Okay. Real quick, let me finish. So how you do it, I'll demonstrate it right now, how you go about this. And obviously you don't want to put your hands in your child's mouth because you get bitten, right? I've had enough battle scars to tell you don't do it. Just never put your hand or fingers inside of a kid's mouth. Thankfully, I'm strong enough to like pull out fast enough, like some, like 90% of our industry are girls. So it's very difficult. So anyways, so you put this inside of a cup of water, right? Like I am right now. Right? Put it inside, soften it. And then you check. So you check up here. I forgot the names of this. Very long ago, I used to write reports about this. I remember everything. But anyways, you go up here and you go like this. So there's a tie here, and you don't want to hit it. So you go like this. You pull out a little bit. You go back in, and then you just check, right? So the normal response after you do this for any person like me, you and me, will be like just moving our mouth a little bit, normalizing it, right? But for kids who are hypersensitive, the moment you put it there, they tense it up. You can't even move it. So then it's already hypersensitive. Okay, and then after that, you go down, and here you don't have the tie, so to speak. So you can go right across. So again, if they're hypersensitive, they will go like this, and they won't let you go anywhere. If they're hypo, after you do all of this, they won't even move. Right? They won't even find it ticklish, and they just stay there. And usually their mouths are very flaccid and just like, they're just looking at you like, what are you doing? Right? So after that, you do the buccal area. So here, you draw a C like this. If you can see, you draw a C. You draw it 3 times. All these things you do 3 times. So just now this one, you do 3 times. This one as well, do 3 times. Again, if hypersensitive, you can't move it. It's just stuck, right? And you draw C's both sides. And then after that, you go up here at the palate, the hard palate, and you draw a zigzag inside like this, like that. So when you do a zigzag like that, be careful because kids' mouths are very short. So if you like zigzag too much, they're gonna vomit. All right. So just a little bit. And then the last thing you do is zigzag on the tongue. Again, don't go too deep or else they are going to vomit. So that's like that. So anyone like me, I find it ticklish. So again, why you want to check this is because if you're doing this oral swabbing with a toothette, right? And you see that there's a hyposensitivity, hypo as in like not enough around here, then that's where you need to start brushing. So all this swabbing and brushing, it normalizes sensitivity, right? That's why you see a lot of occupational therapists. I'm sure you guys have had a talk with an OT before. So a lot of occupational therapists do brushing, right? Use like sandbags and brush all around to normalize, so to speak. That's the word for it. The sensitivity of a kid. Okay, so when we do this with the toothette over and over, the problem is that you can't get into it, right? So the biggest problem I see, sorry, I need to give this caveat real quick. So the biggest problem is you get into tactile defensiveness, right? So what is tactile defensiveness is basically, I can summarize it as in you must have a friend who doesn't like to swim, right? And it's not because they can't swim or whatever, it's because they had a bad experience before and they never want to go near a swimming pool ever again. So it's the same with kids. They had a bad experience with swab. They had a bad experience with a hair dryer, with scissors, with clippers and whatnot, like the hair stuff. They're never going to touch it again. So therefore, you need to ease it in. And same as brushing teeth. You have to let them do it on you multiple times, and then do it on a soft toy, right? And then go slowly from the hand up, brush from here. Go from not sensitive to sensitive. Obviously, if your son's or daughter's hand is sensitive on the hand, don't do it there, right? But move slowly up to the neck. Make sure it's not intrusive, and then you can start there. All right. And a very, very important tip is that whenever you're doing this, remember to always do like a Nike tick for jaw support. Just open it like this, right? Because if you're always trying to pry open in the wrong way, it's going to hurt them. So jaw support, open it, go do that thing, okay? And the second part of this is awareness for drooling. So some of the times they know if they knew that there was water or drool, saliva on their mouths, they can manage it. They'll go like that, or like they'll do something, right? The problem is they're not aware, right? So it's a behavioral problem. So what you do then is that you do it in a very behavioral manner, and you have a bottle of water that you can spray. So you spray it on their mouths here, and then you tell them it's wet here, and you prompt them to wipe it off themselves. And then you reward and praise, right? You keep on doing it. And then you in the beginning, you make it very like you spray pretty hard, like you put a lot of water onto them. And it's like that. And then it's just to be very like, how to say, you want to make it so obvious, like, oh, obviously it's wet, right? And then after they wipe, you like, oh, that's right, nice wiping your mouth. Your mouth was wet. Good boy or girl. And then you can reward them with like some toys or whatnot, right? So you go small and small, maybe a drop later on, and then you systematically make sure that they start knowing themselves, right? And then if your child is understands a lot more language, you can also prompt them by asking, you can ask by like, is your mouth wet, right? And you need to trick them, right? Sometimes it's dry, sometimes it's wet, so that they don't always say it's wet, and then they want to get praise or whatever. So sometimes you need to be tricky. Once you get to that point where it's just one drop, and you ask, is it wet or dry? And then if they know it's dry, you still should praise and reward. So it's like a trick question. So it's more like a identification task there. So basically, if we go through all these, kids usually stop drooling when you deal with the sensory and the behavioral stuff. Okay. So before we go forward, did you guys want to ask something?
Yeah, I think we have a couple of questions out there. Are we ready to move over to Q&A, or is it okay for you?
Yeah.
Okay, great.
That'd be okay.
All right. So Anna, you just have your hand up right now. Why don't we go with you, and then I'll prepare the other questions.
Yeah, thanks. 2 questions. What was that thing called again? The one that like a sponge?
Oh, this one. It's called
Yeah.
toothet.
Tooth.
Like a thet, like a how to say, like a cute name, like toothet.
Yeah, I'll
Like
put it in the
Toothet?
chat as well.
Yeah.
Okay. And the
Right in the
second
chat.
question is,
Yeah.
since you're talking about orally, he started before he wasn't doing it, but now he's starting to chew stuff. Like he'll grab a towel and he'll start chewing. He'll grab a cover and he'll start chewing. Would that had something to do with what we were speaking about?
Yeah, it might be like there's a, like there might be a few reasons why the mouthing and chewing is happening, right? So it might be that they are delayed, and this whole thing was delayed from a long time, because like this usually happens at around like 6 months to 1 year old, that they're chewing and mouthing and stuff. The other thing is like there's a theory. I would say that it's mostly correct from my experience, and it's called like it's a sensory seeking pattern, a behavior, and it's to do with I don't know if you guys heard of this, like it gets slapped around in the industry a lot. It's called TMJ, it's based temporal mandibular joint, right? So it's right here. If you touch it, you will feel that, it feels like someone's massaging you here. So this temporal mandibular joint, some children have a hyposensitive thing going on, and they want sensory input there. And therefore, when they bite, this expands. It's expands. So if you try to push it here and you try to bite down, it's quite hard, because like, especially for kids. So usually when kids, they don't want to open their mouths, you can push here and usually it opens, because it's pretty hard not to. So what you can do is like, you can give some massage there, right? And teach them that if they're biting you can do that. And also you can give them appropriate things to bite on. But at the same time, this is like a double-edged sword, because it depends on your child's jaw stability. So I don't want to get into too much technical stuff here, but if you if your child is like jaw, what we call like jaw sliding and gliding, so it's like this, and it's like the chewing is not up and down, then it's best that you do not give him like a chewy tube to chew by himself, right? It's better that you give him a massage and teach him how to chew properly up and down with proper jaw support, right? I hope I answered that question without further confusion.
Great. Well, Michelle has a question. If after swabbing you found that they do have sensory problems, what do you do? Is it you add more swabbing and brushing? What's the next step?
Okay, that's a fair question. So it depends on whether it's like hypo or hyper, right? So if it's a hyper situation where it's too much sensory, they're like, they're trying to run away, then you have to think about whether, if it's a tactile defensiveness issue, like I talked about just now, it's a behavioral thing, then you have to first of all desensitize that object by like, disarming, so to speak, disarming the situation and say, oh, look, it's not that big of a deal, right? If that's not a problem and they're okay with it, it's just that they're sensitive, then all you got to do is to do it softer, put more water on the brush and keep on going, right? But whereas if it's a hypo sensitive situation where they actually don't really feel it, you have to go 2 routes. Number one is to add temperature, right? I see some therapists, and I do it as well. We use ice onto the brush, and then hopefully to like, so to speak, ignite their sensory, right? Or you could use warm water, okay? And what people do as well is like, they, when they sell this thing, they also have like a turning, vibrating thing, and that actually helps with providing more sensory input. But like, you can always just put it on top. Like, you can just always put a rubber band around like a electric toothbrush and just use it that way. And that's what you do. You keep on doing the brushing thing, but it depends on whether it's hypo or hyper, and you keep doing it until they're normalized and they're okay with it.
Great. Thanks for that. And we have a Zoom user with their hand up. If they want to just open their mic, they can ask their question.
Yeah.
Yeah. Hi. I was wondering if you saw any correlation between children like my daughter who had tongue tie surgery at a very early age and then getting either hyper or hyposensitive. We know that it's very difficult to get anything inside of her mouth. And then is there a correlation between speech delay and those type of surgeries? May she have been traumatized early on?
How old is she? Sorry, like how
She's
old?
now 2.5. She was now 2.5. She had tongue tie surgery when she was 2 or 3 weeks old.
Oh, well, if that's the case, then that's a little bit too young to do the tongue tie surgery for her to remember any of the
Right,
bad
so that-
stuff.
Right.
Yeah.
But,
So
but there's
you,
no residual trauma there. She wouldn't remember any of that.
I can only guess.
Right.
Like it's too early for her to remember
That's
anything.
what I would think. But have you seen a correlation between people who have had kids who have had tongue tie surgery and then speech delay later on, or is there no correlation, in your opinion?
Yeah, there will be there actually is a correlation, but obviously this is like for children who are like they got the tongue tie surgery done later
on.
in their life. Yeah, so for your situation there isn't really, but at the same time you can make the argument that like the tongue tie. Actually, there isn't any argument. I wouldn't say there would be.
Okay,
But
good.
yeah.
Okay,
So yeah, no problem.
Our daughter also had that, and that was always in the back of our mind. So I think that's a good question because it's dealing with the mouth, but I think maybe like as Ming had said, it's so early on that they have time to adapt and overcome it. But it's still good to be aware of if you do start to see issues, it could be something else. There may be some other underlying condition. You don't have to necessarily connect it back to the tongue tie issue, and it could be just, as one doctor had told us, instead of trying to analyze what is the exact cause right now, analyze the symptoms, and then you can start to connect the dots, because it's not always a linear path. Like, oh, we see this, it connects to this. It may be just a long journey. And just to kind of circle back to what Ming had said at the beginning, it's very much a time thing, an investment in time. We have been working with our daughter for 5 years, and only after 5 years did we start to get 4-word sentences, and we're still very much committed to it. And we can't pinpoint, we know that she has hypotonia, but we can't pinpoint exactly what is all this speech delay coming to, but we're approaching the symptoms. So I really do like that question. Ming, there's a question here about a child born with a cleft lip, a cleft palate. He'll be 2 months and continually chews on things. Could the cleft have caused an overactive TMJ?
The thing is, like, to be very honest, even if there was, the treatment will still be the same. Like it doesn't matter if it was caused by something. Just like I just allude to what Richard said just now. It's just like sometimes it doesn't, like for kids especially. Even if we knew that there was a correlation, it could be a basket full of causes that we don't even know about. So it could be that it was, right? It could be, but at the same time, the way of providing intervention is still the same. So it doesn't really matter if it's the cleft has caused an overactive TMJ. It might not even be an overactive TMJ. Is that it's a delayed sort of like reflex, right? That your child is overall, like there's loads of reasons why, but you can always see if a TMJ massage will actually help with that chewing. And if it doesn't, then you know that it might be that it's a delayed thing.
Great. Yeah, and one just came in from JP. His daughter's 2.5 now, had an undiagnosed tongue lip tie. They had the operation done 2 months ago. Is there any links to teeth being brushed and access to her mouth? Not liking or the sensory?
Yeah, again, so there should be. I don't know. I really don't know at this point in time, right? There's loads of reasons that it may or may not be, right? But you already know what you can do given like what I told you today. So about like tongue lip or tie, usually it doesn't really have any problems with like brushing teeth, unless every time when they're brushing your teeth, it hits some of the ties and it causes like some inflammation and it makes it a bad experience, right? So you got to understand, JB, whether this is a behavioral problem, is that they have a trauma towards it, they're tactile defensive, or is that is a real sensory problem? Usually speaking, after a tongue tie or lip tie operation, the sensory profile of a kid it becomes very different, because now their tongue and their lips can go, the range of motion is a lot more than before. So therefore they're finding new places, and therefore they're like, oh, my mouth is like that. And you usually see a problem in talking, because what happens is, like, after the surgery, they have, I don't think it's too much of a problem at 2.5, but older children, for those who might be interested, it's like around 4 or 5 after like a surgery for a tie, is that they develop so many ways of going about saying a sound that they usually can't with the tie. And then after the surgery, they're like, oh, actually I can do this. And then you see a lot more speech errors, right? And you see that they have some sensory issues because they've never touched that part of the mouth before, right? So I think, if you ask me, are there any links between not liking the teeth being brushed and access to our mouth? I truly don't think so at this point in time. But like, what you can do is to go through the steps and think about whether it's a behavioral problem or a sensory problem, and you're equipped with both things about how to deal with it.
Great. And then we just have 2 more questions. And one from Hong: is there any recommendations for toys to use in the swimming pool to help develop speech? Going
That's
back
very
to
specific.
developing the interest.
That's very specific.
Yeah.
Using a swimming pool. Yeah. I let me just think for a while. So I've done this with kids who like the bathtub, but I haven't done it in a swimming pool per se. So you can use the like wind up toys that move, on water. You can also use water guns, right? And then what else can we do is, those floating balls, just any balls that float can be useful. A towel is fun because you trap water inside, and then you put it underwater, you press it, all the bubbles come out, right? It really depends on your son's or your daughter's interests. Maybe you can use like an underwater speaker, right? And play some music underwater. There's loads of things that you can do. It depends. Like, think about in terms of sensory. What can you do visually, right? What can you do auditorily? What can you do physically, right? Kinetically, and then you go about it that way, and you think about what effects you're trying to do. Obviously, you can't use bubbles in a public swimming pool. That's not going to be good. But usually, we use a lot of like foam and bubbles, is what we do. Hopefully, that gives you some ideas.
Then we had one from Karen. She just asked about, and it was an interesting question. It kind of goes back to hyper being overly and hypo being under, which is the difference. I'll put that in the chat. But what do you do if someone's hyper verbal?
Hyperverbal.
Yeah. Interesting.
Recites many scripts. I see. Okay. So it's more like, he has ASD. So that explains a lot. So usually when you're hyperverbal and you are like, there's a lot of scripting, a lot of jargon going on, that's actually to do with ritualistic behavior more than sensory, right? And usually, like, you can look this up. There's something called like Gestalt language processing, right? It's a theory, so to speak. But what it means is just like any old person, like who's really interested in something, that they can recite all the movie lines, right? Wait, what was that? What was the question actually? What they can do? Is it, or was it like a comment? Let me see. What to do?
You can't seem to focus. So it seems like they're trying to develop a speech routine, but they can't get past hyper focusing or.
I get it. Sorry about that. Yeah. So, given this, I think there's loads of opportunities to teach this child because he's got a lot of wants. So use those sensory seeking in the mouth to teach some like other type of like play sequences, and use those TV commercials and movies to create like create the scenes out with figurines, right? And then change things ever so slightly every time so that it's just not like the same script, right? Maybe like you change a tool this time, maybe it's a different person. Create more scripts, right? Create scripts. Teach them how to play like a supermarket game with you that has a strong script in it. Like, I want like I'm buying these like whatever tomato something, and the script is different every time. Like do a restaurant game where you are the waitress and he's the customer, or and you guys switch roles, and maybe it's like doctor and patient, that there's a script, there's a strong script inside, and you can write it out, and you can like, you don't need to use words, you can use pictures. And every time maybe the menu is different, maybe like the doctor's diagnosis is different, the tools you use is different, and you can use it that way and use that scripting and all the things he likes as the reward. And like you just need to create more routines that he likes with you instead of like through screens and stuff. So that's a short version of it. Usually that works. You shouldn't. And you were asking about like doing school worksheets at home, right? Just use the mints or whatever as the reward. As a finished one, to give him a mint, right? Make the mints as small as possible, so that he keeps on wanting it, and slowly reduce the amount of mints he gets. Like maybe like it's 2 questions and then he gets a mint, and then 3 and then 4, right? So you just want to push him that way so that he understands. He does something, he gets a mint, you know?
Yeah. And I like the idea of making it as small as possible, because you want those rewards, and you don't want to, what did you call it? The battle of, giving these things that we know are maybe not good for a child, but it works.
Yeah.
Using those to our advantage. So Key, you had your hand up. Did you want to ask your question quickly?
Yeah, hi. Min, thanks so much for this hosting the Zoom call. So I have a question about these tricks are great. I mean, the tickle, I was just thinking I just tickle him, but I don't say tickle. But just an example of that. So I speak Cantonese. My husband speaks Hungarian. And yeah, so Nehoma.
Leo.
And my husband speaks Hungarian, and we're going to speech therapy with English that teaches English. So I've been doing a lot of the therapies in English, but how do I incorporate like the Cantonese and then my husband's Hungarian, even for a simple game as tickle, right? So I mean, should we just focus on one, but then, because they say, you want to give them as much language up to the age 3, because that's when they absorb the most. So how do we do that? Mm-hmm.
Okay. So practically speaking, and what the data is saying in the industry is that you can say the word in different languages as much as you want. And how you practically do it is you say, like, for instance, tickle. You say it once in English. After you tickle, you always give a verbal feedback after the behavior is done, right? So you go like, your hands are like this, and you tickle, and then after you tickle, and then he's like, ha, 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 and then you give a verbal feedback, as in, if it's in Cantonese, that, yeah, zit, right? Whatever. Yeah. So you say it once in front with one language, and you give feedback in another one, right? That's one thing that is proven to work through data, and you can switch it back and forth, because what you're trying to do is like,
you say tickle. You say tickle in English, and then you say, what's the feedback? Chica, which means tickle again.
Yeah. So practically, what you're doing is like you're teaching language to behavior, right? So tickle means I will tickle you, right? And then you give a feedback in Cantonese. That's also cool. So he's gonna have to learn the word twice, right? But if you use it as feedback, and sometimes you use it in the front, sometimes you at the back, it's gonna take longer, but it's gonna help him understand it's the same thing.
Oh. Okay.
Yeah, I really
when we say so he actually understands the language. So for example, I'll say I in Cantonese, and in English, and in Hungarian. He points to it. So he points to things, but he's not saying it. So that's so he seems to understand, but he's not really, the words aren't coming out. So what do you think is happening there?
Yeah, I mean, like, have you ever? What's his true ability, right? Going back to that, is that
okay?
Yeah, you need to think in like, what's the lowest thing you can do for him to do at his highest effort. So, for instance, if right now he knows how to gesture and point for me, right? But if you have something that he really wants, and you push him to say something, and maybe that word is too hard, you can reduce it into just a verb. Just a vowel, and see if you can do that. And if you can't do the vowel, just do a mouth shape, right?
Oh, okay. Vowel?
Yeah. Like or for me is oh, right? Oh, like that. And if that doesn't work, you go down one level and only do the mouth shake and see if
Oh,
you'll
I see.
copy it or not.
Okay. Okay. Oh,
Yeah.
thank you so much. Okay.
Yeah, no worries.
Hey, Neil, you raised your hand. Did you want to ask something? I'm going to respond to a couple of these in the chat.
Yes, can I ask my question now?
Go for it, Neil.
Okay, awesome, thank you. Mine is kind of a more of a logistic question, but first, thank you for hosting this session today. It is. I noticed that there was a series to sign up for, and I'm interested in the series. Is this the same format as the series, where it's a live session we schedule? And my son talking. Sorry. It's where it's a live session that we join together like this, because I mean I enjoy this format, and I didn't know if it's going to be like a recorded series that we log on to and watch it on our own, or if it's a common we join together like this and we can hear each other's questions. And I don't know if you were going to get to that at the end, but I figure I'd ask the question. Thank you.
Yeah, I might as well just go ahead and share it just in case anybody needs to leave early. And thanks for hanging on, Ming. But yeah, we do make this series available. So our next one is going to be about sensory integration, and that's on May 21st. So it's a third Sunday, same time as this. And then we have another one in June, and this will be our last one in this series. But what we wanted to do was we wanted to bring caregivers together, and we may change the format a little bit. But what we found out was when we have this ability to have the interpreters, we could really come together, because if I do it by country, the turnout is maybe 2 families, 3 families. I don't mind it. We do that still. But when we have a larger group together, someone will ask a question, and then someone in Argentina really connects with that question, and then those parents can connect afterwards. So we'll continue to do this once a month. After the June one, we're going to have a meetup. Most likely it'll be in Taiwan, which may not be easy for many of the families. Where are you at, Neil?
I'm in California.
Okay, we'll come on down to Taiwan if you could make it, but we'll do one there. But after we do this meetup, we'll reevaluate how we can do these more often. And we do make it available online. So I'll send you a link, or I'll send you a newsletter after this, and it links back to our previous episodes about physical therapy, occupational therapy. Now we're doing speech therapy, and then we'll keep you updated about the next one. So thanks for bringing that up, and I'm glad you enjoyed the series.
Thank you.
Ming, if you got time, there was just one more from Antonio, if you didn't mind answering his question.
Yeah, we can do more questions. I'm okay.
Okay,
with that.
good. Okay, yeah, there was one from GNM and Antonio.
Sure.
So GNM asked, I'm probably going to mispronounce this, but echolalia and misarticulation improve with age in kids with ASD?
Yeah, so it's man, that's a trick question. So it depends on how, like, let's talk about echolalia first, right? Echolalia is what the parent just now was talking about, like scripting, jargons that are from places that he or she has heard somewhere else, right? Does it improve with age? It really depends on what the function of the echolalia is, right? If the echolalia is for like language learning, which every kid goes through echolalia, but if your child is already on the spectrum, then there's a high chance that this echolalia is a form of like self-stimulation, meaning that they're trying to entertain themselves, so to speak, right? So if that's the case, and your child doesn't like pick up more meaningful ways of using language, meaning like the things I've talked about in this whole talk, right? Through play, like expanding on play and using language to comment and ask for, and also to manipulate you, then echolalia might not improve, right? And for kids who are on the spectrum, the problem is like they can echolalia all they want, but the problem is they don't know whether this is appropriate or not, right? Socially speaking. So if you need to intervene with children or people on the spectrum, that echolalia is fine if you're just in your room, you do whatever you want. But once you're outside, why you don't do it is because people find it strange, and you don't do it because people don't want to communicate with you. Therefore, if they don't want to communicate with you, you lose out on a lot of stuff, right? Friends, fun, so on. And then misarticulation, on the other hand, it really truly depends on whether, like, usually it does, but it truly depends on whether the child is aware of it, right? They might not be aware of it, right? A lot of people, like with my ears, because I hear so much sound, like speech sound errors, the S sound, a lot of people don't even know they're doing it wrong, like just typical people like you and I. So it depends on the kid, the child knows that there's a misarticulation or not. And if he or she knows, is it because of structural problems? Is it because like of that, there's a tongue tie, whatever. There's loads of factors going in, whether this will actually improve with age. And that's why in the beginning I said therapy in itself is a risk thing. Like, you're trying to mitigate risk, right? Maybe it will, maybe it won't, but you got to intervene. That's my answer.
Thank you. And I got a long one from Antonio. So not sure if this is the forum to ask. It's always a forum, Antonio. My son was a thumb sucker, and it was a hinder with the speech delay he has. He has stopped thumb sucking, but is now peeling at an old healed cut he has. The action is not allowing his pigment skin to grow back. We're thinking it's related. Is it? It seems to be a behavioral problem now. And would you be able to recommend a way for him to stop? Putting Band-Aids to block or talking to him isn't working, and he's 8 years old.
Right. So I think it's a mix between sensory seeking and also like behavior. So whenever like all this stuff about like blocking him or talking to him to making it stop, most, like, you need to remember, if it's a sensory seeking activity, or so to speak, what we call it's self-stimulation, you stop one thing, something else is going to happen. Right. So this can happen with anyone. Like, if, for instance, some people, they love to like bite on their nails, and they put on like fake nails to stop it. Right. And then you find later on that they start like playing with the hair. So the thing is, if you don't deal with the root cause, then you cannot actually, it's just going to come back in a different way. Right. So there are two ways, actually, there are three ways, but I'll talk about two about dealing with behavior of such. And I'm sure when you get to the series about behavioral therapy, you'll learn more about it. I'm not expert at this, but anyways, number one is, can you create a replacement behavior that does something similar, right? Maybe it's something like peeling stickers or whatnot. I really don't know. You need to expand on that and think about like how you can make it so that he has something else to do rather than peeling his skin. The other one is what we call a reactive thing, a reactive method. So if he doesn't peel his skin, what does he get? I'm saying that you should reward him for not peeling his skin, right? So what you do is that you talk to him and you tell him, he's 8 years old, he probably should know some stuff. You say, hey, listen up, you want this, right? How about this? If you don't touch this for 30 seconds and you put on the timer, then you can get X, right? Get this thing, right? So you put on a timer, you tell him what's the target behavior, right? And you give him 30 seconds to not touch it. You can do anything else and you're watching him, right? Slowly increase the time, increase the reward according to the time as well. And then later on, it could be just a day, right? And in that time frame, you can start trying out different replacement behaviors, right? Some of which might be a little more appropriate, such as, like there's not much that's appropriate. you could teach him to put some Band-Aid on him and then like tell him to peel off the Band-Aid instead of the skin, like maybe put some tape, that like masking tape doesn't hurt as much. It needs to be more like socially appropriate. I cannot come up with anything right now on the spot, but you got to think about it in that way. Like, can you put a what we call a behavioral system in place? Is that you give a certain time frame that if he doesn't do a certain behavior, he gets a reward, right? And then after that, you need to have a replacement behavior, because if you stop him, he's going to do something else. So you got to do these two things.
Yeah, and we used stickers, and that worked out very well for us. And that was also a way to kind of incorporate fine motor skills, which our daughter needed to work on. So how you said about that context, the stickers worked very well, and she just enjoyed peeling the stickers.
Yep.
Tammy had a similar question, but it also sounds behavioral. So sucking on the index finger isn't verbal and likes to hold on to things with both hands at all times. Any suggestions for that case?
Yeah. So about this stuff is more like for these type of cases, what you got to do is you got to do a lot more sensory stuff, and I really suggest that you work with the OT on this. And other than that, if he likes to suck on his index finger, give him something else to suck on first instead of like quitting cold turkey, right? And if he likes to hold on to things with both hands all the time, I think that's fine, but you need to make it, like, you need to teach him some play routines like I talked about here to make it meaningful for him to hold on to things, right? Or teach him why he has to let go of things, because it's taking turns, right? Or he has to give you something, and he has to let go of something, right? There must be a reason, a context, and an intention to do something. So if you're always snatching stuff away from him, and he doesn't, and he has to have that quote unquote security of holding something, which a lot of children have, then you gotta give him a context about why he has to let go, and at the same time about sucking his index finger. Make sure that you check with the toothache or anything that is spongy to check his oral sensitivity. Then you will know, oh, it's actually probably his sensory thing. And if you fix that, maybe his index finger sucking will be gone, but you must have a replacement behavior for him. Okay.
And Neil, sorry. Neil, you're back again. Did you have your question?
Yes, please. So the first question I had, it was actually around the Talk to Me 8-week program. And so I didn't know if that program is still available to join. And also the question was in that form, is that program in the same format where the participants join together, or is that like a recorded series that we watch on our own time?
Okay. So I guess, Neil, you came from my end. So yeah, so this is actually with this nonprofit, this talk. So the 8-week program is something that we offer from our end, but right now it's not. We've closed it for now because we have a bunch of parents I'm working with. So at this moment in time, you cannot join, but we'll open up probably like in the next month or so. Not sure yet, and the format will be different. Like there will be recorded videos that you can walk through, like you can watch through yourself, but we have a Telegram group where you can ask questions and send videos. And that's in real time, that part of it. But we won't have these kind of Zoom meetings because everyone's all over the place. So we can't really do that.
Got it. Thank you.
No worries.
Yeah, and in the newsletter, I'll definitely share Ming's contact. So anyone else that wants to join into some of his series or open his case, it really worked for us because even if we brought our daughter to speech therapy, there wasn't too much she could do at the time. So one of the interventions that we really liked was being able to work with our daughter at home, prepping her for her speech therapy. That way we were able to accomplish a lot more because inside of our home environment, we could do a lot more with her than when we brought her to speech therapy because of, sensory processing issues or, just the length of time. So it was a lot of work that we could do at home to kind of help that. And so I'll definitely, Shiva, share that Telegram group. Maybe our last question was, how about someone that's verbal? They're making high-pitched noises, screaming. This is also applies to our daughter. What do we do with children that are communicating that way and trying to, transition them to speech?
So the thing about high-pitched noises and screaming is like, what is the function of that behavior? So this is something that you can ask next time with Rare during the behavioral therapy session. Is that it's all about like behavioral analysis, right? It's about thinking about what the function does this serve. So if it's like most of the time, 80% of the time, the high-pitched noises are only two reasons in my case, in my understanding, in my experience. Don't know if it's true or not for other people. So number one is to get your attention. whether attention is negative or positive, doesn't matter. So if they scream and you say like, hey, stop doing that, they might like it. It might become a routine, right? So you have to think about, can you do an experiment is that you don't care at all and see if the behavior escalates. Because it's like, give me an example. So I know that if I kick a vending machine, a drink will come down, then I'm going to kick it, right? But if one day I kick it, nothing comes out, what am I going to do? I'm going to kick it harder. So then the true reason for the high pitch is for your attention. If you try it that way, right? And the other reason is either to get something from you, or it's a sensory thing. So the biggest problem is that if it's a sensory thing, it's quite hard to find a replacement behavior. And when you do a lot of high pitched noises, how does the child what does the child do? Does he cover his ears? What is he doing? Is he running around? All these you have to think about. And when you find that and observe about how your child is doing this, you can start thinking about what replacement behaviors you can give. So, sorry, the more I talk, the more I remember and think the reasons for all these high-pitched screaming. So some of them are sensory overload. So is it that the volume of something is too loud? Are they hearing something you can't hear, right? Are they smelling something that you can't smell? Are they seeing something you can't see, right? Those things you have to be careful about. If it's a sensory overload, all you got to do is just to remove the sensory, right? If it's that is trying to get your attention, just ignore, right? And teach an appropriate way to get your attention, which is usually just tapping you. And then if it's the child's screaming to get something from to get what you want, what he or she wants, then again teach a gesture so that they know if they do a certain gesture, they'll get what they want, right? Yeah, I think I covered nearly everything for now.
Well, thank you for that, Ming. And again, I will make all this available in a newsletter. We make it a landing page. Our past videos will also be available, and I'll make Ming's contacts available so you can reach out to him directly. It's a great resource. And when we think about the way the internet is changing everything today, we don't have to be, we don't only have the options that are available in our city. We have options that are available around the world. That includes Ming, that includes the other caregivers that we like to link up with. Lena mentioned her case. We really want to connect with you, Lena, because we're reaching out to more schools, more caregivers, babysitters, anyone that has contact with the children that, hey, I want to help this child. What can I do? And we want to empower you. And obviously you still go to a qualified speech therapist, but there's things that you can be doing during the daytime. Ming gave us a lot of those strategies that we could be doing as parents during the daytime, and they help make a difference. And I would just like to close with a final comment, kind of just tying into what we learned with Ming, is as parents and as educators, we know the power of play. So at the very least, get on the ground, start playing with your child, figure out what their interests are. And when we think about speech, it's more about communication. And it's not just getting words to come out of your child. It's coming up with a way that you can communicate with your child effectively and then building on that. So for our daughter, she wasn't speaking, she was screaming. And then slowly over time, we were using gestures. We were slowly building those words. It was a long time, but during that time, we had these small milestones that we celebrated, and we figured out the ways to develop our routine so that we could communicate. Our daughter couldn't use words and still has trouble, but we can still communicate with her. And so making sure that we understand those communications so that when we're doing things with her, we understand, okay, when she's doing this, it means that. And then when we communicate back with her, she understands us. So it's not something that's done overnight. It's a long process. And we really do appreciate everyone joining us today. And thank you again, Ming, for staying on late and answering these questions.
Yeah, no problem. Do this for a living. So it's always energizes me to talk to parents and answer questions. It makes me like, I need to be creative, to think, and it's not only me in the clinic room. So it's good to talk to parents all over the world and give some sort of solutions to things that I cannot see with my own eyes.
Yeah, thank you again. And thank you, everyone. We'll close the meeting. And yeah, in our newsletters, we do make available some other resources. So if you get the newsletter, though, everything that we do is completely for the parents. So we generate grants and revenues, and then we make that 100% available to the parents. So please do stay tuned. We do try to support our parents as much as we can. And I appreciate everyone joining.
Thank you, guys. Thank you, Teach Rare. Thank you, Richard and Judy. Thanks for having me.
All right, Ming. Late night for you, so enjoy your evening.
I'm good.
Thank you all.
Thank you so much. All right, bye-bye.
Bye.